What's going on, guys? Dr. Greg here with Movement Driven Performance Physiotherapy. Today we're going to talk about some of the simple movements and muscle contractions and exercises that I like to give people who are pretty close to their post-operative state after a knee surgery, such as an ACL repair or a meniscus repair or a meniscectomy or just a scope of the knee. This is also really good for somebody who just has a knee contusion or some type of blunt force trauma where there's no ligamentous damage, but there's some swelling, there is some pain and an inability to kind of fire the quad well and move the knee comfortably. So this is a good way to kind of get you walking better again and just to start off the process. So the first thing we're to go over is quad sets. So a quad set, essentially, I'm just contracting my quad muscle and flexing it. So what I want you to do here is put something like a towel roll or a little pillow under the knee. And what you want to do is squeeze the muscle, squeeze the quad muscle to where you're trying to push your knee down into that towel. Kneecap is coming up as I squeeze. The kneecap is coming towards my hip. And I'm really trying to contract, get that little teardrop muscle on the inside to kind of pop out, see it flex. As you can see, as I push down, my heel is kind of starting to lift off the table a little bit. What I don't want is to squeeze and have everything kind of just contract, because then I'm having some co-contraction of the hamstrings. I want to really isolate the quad. So I'm squeezing and my brain is thinking, lift up that heel and do a little kick as my knee goes down. Now, if you have substantial injury or just after surgery, there's probably a lot of swelling and some stiffness in the back of the knee. So you might not be able to get this, or you just don't have that motion to begin with. So that's fine, but I do want you to really think about trying to facilitate that pattern of squeezing down and kicking up to try to get that quad to activate a little bit more. So usually what I tell people is get the motion down pat, then begin to hold for 5 seconds, maybe do 10 reps of that, work your way up to 10-second holds, and really just get comfortable and build the muscle memory of the brain and that muscle communicating in a better way. Again, especially after surgery when you have a lot of swelling. From there, you're going to take that into a straight leg raise. Now, you can do this sitting back. You can also lay down. But essentially what you're going to do is you're going to start the same process. I'm squeezing down, I'm kicking that heel up a little bit, and then I'm lifting up the leg. When I lift up, I don't want to have a knee lag, meaning I don't want to come up and have that knee bend a little bit. I'm exaggerating. I really want to keep it straight and really exaggerate how straight I'm trying to keep it as I lift up, and then control nice and slowly to the table or the bed or the floor, wherever you're doing this. Completely relax everything. Fire it again. Quad set, bring it up into a straight leg raise. Okay. Usually I have people lay on their back to do that one, and then they can get a little bit higher. They're not working the hip flexor too much there. The last one of this little series is called a heel slide. So this is just a good way to get some motion in a non-threatening way of the knee, and it helps to kind of get what we call perfusion to the joint and pump out some of that swelling and get some, like I said, range of motion, as well as alleviating some of that pressure in the knee. So for this, you can lie on your back or sit up against the wall or something like that. Put a stretch strap or a towel around the heel. The towel's kind of helping, and I'm just pulling in back and forth, letting my leg do as much work as it can, using my hamstrings a little bit to pull that heel towards my butt. If that feels good and you don't need the hands at all, then do that. But if you're really stiff, especially after surgery, then you can use this as a little bit of overpressure to pull and get a little bit of a nice stretch through that knee. This is the kind of thing that you want lots of reps. Keep it active, keep it moving to flush out that knee and keep some fluids moving in a good way. So do 15 at a time, do a few sets of that. Now, all of this stuff, I don't necessarily want you doing just one big session a day. I want you to do this multiple times. So usually say at least every couple of hours, get a set of each in, move it around. The knee doesn't want to stay stiff all day, especially if it's super swollen. So repetitive small sessions of this every couple hours while you're awake, and then you do your ice, do your elevation, and hopefully it'll start feeling better really soon. But consistency and frequency is key here. Try it out. Let me know how it goes. If you have any questions, give us a call.